Here's everything that happened in medicine and healthcare today in 60 seconds or less. Right off the bat, we had a big study that was talking about that the types of hormone replacement therapy that women undergo as they age can change their likelihood of risk for breast cancer. So when they looked at women from 16 to 54, they found that those that took estrogen-related hormones found that they had a 14% lower risk of developing breast cancer before 55. However, those who took progestin and estrogen had about a 10% increase. There was another big study that was also talking about the risk of air pollution and its impact on your overall health, similar to secondhand smoking. Basically, the researchers looked at a bunch of people who are never smokers across a bunch of varying regions. When they got the genetic information for the tumors, they then looked at what was the air pollution in those areas. They then found that those who are in higher air polluted areas had more cancer-driving mutations in their tumors. Interestingly, they found that those who were using it had just the same mutations as those who were regular smokers. But when they looked at individuals who had secondhand smoke, the mutations were less, meaning that air pollution may have been actually worse. Lastly, a very sad study right before 4th of July showing that processed foods like hot dogs and other drinks had a higher risk of colorectal cancer and diabetes. However, I'm really not sure how they did the study because the results are that those who ate just a single hot dog a day had 11% higher risk of type 2 diabetes and a 7% greater risk of colorectal cancer. And I don't personally know anyone who eats a hot dog a day, but maybe you do. More importantly, those who drink one 12-ounce soda a day had an 8% higher risk of diabetes and a 2% higher risk in ischemic heart disease. However, they sometimes recommend that you can enjoy it on things like 4th of July for cultural reasons. If you want all the links that we talked about today, you can find it in the Substack with the link in my bio, or if you want to help support the page, there's some ways for you to do that there. But I'll see you tomorrow and we'll go over everything then.